So health promotion of the toddler and the family. So biologic development, weight gain slows to 4 to 6 pounds per year after when they enter toddlerhood. So this is age 18 months to 3. Birth weight should be quadrupled by 2.5 years of age. Height increases about 3 inches per year, and growth is step-like rather than linear. So you're going to get, instead of the height and weight growing at the same time, you're now going to see a weight increase and then a height increase, a weight increase and then a height increase. Or if you're like me, a weight increase, a weight increase, a weight increase, and then a height increase. Just kidding. Okay. Maturation of systems. So most physiologic systems are relatively mature by the end of toddlerhood, meaning like their heart and their liver and their kidneys. And you're going to start to see the whole upper respiratory infections come into play. Now, many of you will say, oh my gosh, I saw those with infants. Again, you have to understand that these developmental things, they always talk about scenarios where baby is not exposed to as many germs as they would in daycare, although they really should, because most people's children do go to outside care. Otitis media, which is middle ear infection, and tonsillitis are common among toddlers. You really aren't going to see strep infections in infants because they do not have the hypertrophy of tonsils that toddlers do. So this is the time children get their voluntary control of elimination, meaning they can tell their body when they want to pee. They can control their pee and their poop. Sphincter control is starting to come into play about 18 to 24 months. Now, people will tell me that they got their kids potty trained at 18 months. Some people will tell me that it took their son till they were age 7 to get through the night peeing. Everybody's different. There is a huge spectrum. It is a whole new world out there now when we talk about potty training, especially with nocturnal potty training among young boys. Again, these are just averages, and knowing that there's going to be differences. Now, I will say that after age 6, if a young boy is not potty trained at night, they still need a urology referral. And that's just to make sure that none of this, there's nothing going on. And usually the urologist will say they're fine, and that it's oftentimes can go up to like age 7 or 10. So, and now a lot of people come out of the woodwork. Like my brother could not get potty trained until he was 12, and he had to use the alarm. And then finally when he got the alarm, he was potty trained and it was fine. But still it merits a referral. So remind your provider of that. Gross and fine motor development. So locomotion. Now, this is when accidents are actually one of the higher causes of death in children because they are more mobile and they don't have that great fine motor movement or coordination. It improves between age 2 and 3, but it's still not what, a school-age child has. So their manual dexterity gets better between 12 to 15 months, like their pincer graft. They can throw a ball by age 18 months. They have the toddling gait, which is why they're called toddlers. So Erickson's developing autonomy versus shame and doubt. And they talk about negativism. So obviously learning the word no and being willful is another word for it. Ritualization provides a sense of comfort, so kids respond to routine, especially at this age. So oftentimes, when you have a super newborn, it is easy to not necessarily have the routine yet. But as children get older, you will hear pediatricians say that routine is important, and that's something that you will also echo if you work in outpatient. So they talk about the terrible twos. I don't know if any of you are in the midst of it. I am. It's super great. Ages 12 to 36 months. It's an intense period of exploration, which in my mind it's an intense period of no and getting yogurt thrown on you in the morning. Can you guys tell I'm really tired? So there's temper tantrums, obstinacy that occurs frequently, and it's because the children are developing a balance of independence and parental control. And of course, consistency is really important. And this is when pediatricians will recommend timeout. And they say timeout for each minute they're a year old. So Piaget's stages of cognitive development, they're in the pre-operational period learning, age 2 to 6. So you learn spatial relationships, learning the idea that they cannot jump from bed to bed because there's a huge space. Before that, they would just jump and they would fall short and they would, cry. Awareness of causal relationships between two events. So they're understanding about cause and effect. If they throw the ball, it will go over there. They learn to use and represent objects by images, words, and drawings, so they can start pointing to things and saying, baby, because they see a smaller plate and a bigger plate. So they'll say, baby plate, mommy plate. Or my husband stays at home with the kids, so they'll say, baby plate, daddy plate. And like my son liked to say when he was 3, and mommy plate is at work. The child is able to form stable concepts as well as mental reasoning and magical beliefs, which means they understand, reality, but they're also really good at having magical beliefs that, they drink a cup of tea, they're playing tea, and they really believe that they're drinking tea. Their thinking is still egocentric, so they definitely believe that the world still revolves around them. The child has difficulty taking the viewpoint of others. In moral development, Kohlberg's pre-conventional or pre-moral level. So there's punishment and obedience orientation. Timeout is useful at this age, 1 minute per year of age. I've talked to you about that. So development of body image. So now this is time to refer to body parts by name. Avoid negative labels about physical appearance. So saying things like, no, that looks ugly, or you look messy, because kids actually start to respond to those types of negative comments on their physical appearance, studies have shown. And then referring to body parts by their anatomical name is actually really supposed to be really effective, especially when if you're suspicious of abuse or anything like that. So saying penis, vagina. And by age 2, they will recognize sexual differences by age 2. Development of sexuality, exploration of genitalia is common. They'll talk about, in some developmental books, they do talk about children learning masturbation at age 2. And it's different. It's just they're exploring the genitalia. And some books say, or all the books say to ignore it because pointing it out makes it worse. Gender roles will start to be understood by toddlers, so they'll play house, mommy, daddy, I'm a girl, you're a boy. And now with the ever-changing criteria in gender evaluation, they have shown that gender identity issues can be identified as young as 5 years old. So just keeping that in mind when you are working with these families. So social development, differentiation of self from mother and from father and from siblings, differentiation from self from significant others. Sometimes they still have separation anxiety, but they still struggle with their individualization. So they have increasing level of complexity and increasing ability to understand, but with that comes frustration when they're not able to be understood or able to articulate what they want. Personal social behaviors, so toddlers start to develop independence. Skills for independence may result in tyrannical, strong-willed, volatile behavior, i.e. temper tantrums, right? Because of frustration. I mean, my daughter was trying to feed herself and she couldn't get the bit of the applesauce out of her applesauce cup, and she threw said applesauce. And you correct it, of course, totally wanting to get totally mad because she just got applesauce all over the place and put me in timeout and all that stuff. So these skills, but out of it comes skills, right? Feeding, playing, dressing themselves, undressing themselves, running around church with their diaper off because they learn how to undress themselves. Playing dress up. So transitional objects provide security. So taking a little bit of home from them. This is when loveys and toys and blankies and all that stuff come in handy, especially with transitional things like maybe your parents are going to watch your kids so you can go away for 3 days, or baby goes to preschool, that sort of thing.